Hello, my name is Dr. Brian Reed, and I am a naturopathic doctor. And this is another video about low-dose immunotherapy and its utility in treating chronic infections. So in parts 1 and 2, I talk a bit about the background of LDI, talk about the mechanism of action or the proposed mechanism of action, and also a little bit about what type of patient or what type of patient history would lead a clinician to start thinking that maybe a low-dose immunotherapy is a good thing to consider working with. And reflecting on what I said in the last video, it's certainly not only those patients where they, have a history of plateauing on antimicrobials, and if they come off their antimicrobials, then they flare up quickly and easily. It's certainly not a prerequisite for working with low-dose immunotherapy. There are certainly cases where I believe I mentioned that we can work with LDI right out of the gate sometimes, and it can be very helpful. But it's just, once again, trying to predict which patients are going to respond the best to the LDI, and there's just certain little clinical clues or nuances that can point us in that direction. So I'm going to talk about a case that LDI seem to be a pivotal component of that case. I've had many such cases over the years. I've had many cases where LDI was not helpful, or didn't seem to be helpful at least. I've had many cases where LDI just seemed to flare people up and didn't ultimately provide any long-term benefit, or ultimately any notable obvious benefit. So it's certainly not a panacea, but it's something that in well-selected cases it can be really, really helpful. So this case is a case that I treated probably about 5 or 6 years ago, give or take, and this patient presented with a lot of issues with fatigue, a lot of anxiety, a lot of digestive issues, and then there were some random like twitches and burning pain, and this patient had been to see obviously their family doctor, been to a neurologist, had MRI and CT scan done of their brain, like of their head, and brain is in there, of course, and just all the blood work done, screening for crazy autoimmune diseases and things like that, and like everything looked normal. So kind of the textbook story of pretty much almost every patient that comes to see me if they're suffering from complex chronic illness, like all the imaging and labs look totally fine, at least the standard imaging and labs. And so with this patient, these symptoms have been going on for about a year. They'd been kind of getting progressively worse. And so we started with some antimicrobials. And so, we were working with some antimicrobial herbs in a tincture form, kind of Stephen Buhner herbalist inspired herbs. We also worked with some anti-infectious intravenous therapy, so we were doing intravenous laser therapy, and this patient was herxing pretty easily, and so it just seemed like we needed to work with something a bit on the more gentle end of the spectrum. So we started some low-dose immunotherapy. We used this combination formula that Dr. Vincent has put together, which has multiple species of Borrelia, Babesia, Bartonella, Ehrlichia, and something called Coxiella. And so we were using this combination formula. Tried the first couple of dosages, didn't really notice a difference. The way that LDI works is that we generally start with a low dose and we gradually build it up until we find an effective dose. We build it up gradually because if we dose too high, then the patient will flare, and generally we try to avoid our patients flaring because we like our patients and want them to feel good, not bad. And so we built up the dosages, and it was either the third or the fourth dose, and this would have been over the span of about 2 weeks, fiddling with different dosages, because a dose is given, and sometimes it can take up to 48 hours, sometimes 72 hours to notice whether there's a change from a dose. So we're kind of doing a dose every few days, and it was either the third or the fourth dose that kind of like a light bulb or like a light switch flipped, and it's like, whoa, like I feel better. And so that improvement lasted for a couple of days, waited a few days, did the same dose again, it worked again, lasted a little bit longer, and we needed to fiddle with the dose a little bit, but within about the span of, say, 2 months or so of starting the LDI, patient was doing markedly better, like anxiety was basically gone. And this is one of those cases where there was no history of anxiety, but once this constellation of symptoms started with fatigue and neurological symptoms and burning and whatnot, anxiety came along with that. And it becomes a bit of a chicken or egg sort of scenario. Is the patient feeling anxious because they're having all these crazy symptoms that nobody can figure out? Or is there some kind of neuroinflammatory response happening from, say, neuroborreliosis or maybe Bartonella or some viral infection or whatnot that's creating more excitatory neurotransmitters driving that anxiety process? In any event, very quickly the anxiety just started falling to the wayside, energy's getting better, random neurological symptoms getting better, and the patient just did really well. And so we needed to do some booster treatments with the LDI like every month or every 2 months, but the patient is at the point where every year or two I might have an email or a phone update saying like maybe some things are creeping back a little bit, and so we'll have a chat and kind of go on a booster dose. But it's been about 3 years or so since a dose has been needed, and so that's a really great case speaking to the potential long-term benefit of low-dose immunotherapy. Once again, it's not a magic bullet for everybody, and I do have many other cases like that one where LDI was the big missing piece of the puzzle. However, in many other cases, LDI can be a useful part of the protocol, but we're doing other things too. We're going after the mold, and we're detoxifying and supporting mitochondria and all these lovely things that we oftentimes need to do in these more complicated cases. But LDI is sometimes a pivotal part of a protocol and can be really, really helpful. So I will probably talk more about LDI in an upcoming video, but for right now, that's a case to sort of get a sense of, and I hope that's interesting.